able to apply to your own personal topic and your protocol writing as you are doing now. Okay, so my name is Dr. Guy Wafe. I'm a general practitioner training. Since almost 10 years now, then I have graduated as medical doctor. I've been doing research, biostatistics, working with students for the past 9 years. And yeah, I really like research. That is what I'm doing. I'm also married and a father of 2 wonderful kids. So the aim of this session is that you must be able to identify the research problem for your topic and to write an excellent and powerful introduction for your protocol. That is my aim, that you must understand what is a research problem. You should be able to identify a research problem in your specific context, and you should be able to write the introduction of your protocol. So research is something which is like a systematic process that must be reproducible, which at the end aim to solve a problem or to bring a new knowledge or a new information. So when you think about research, you should really see like something which have several steps that you always need to go through those different steps. You are not the one creating your own way, creating your own steps in the research, but you must just follow the steps which are already defined, which are well known about the research process, and your process must be reproducible, which means that after you, someone else must be able to do exactly the same thing like you. And research exists only because there are problems. If there were no problems, there will be no research that we have to do. So research is there to solve problems. You should really keep that in mind. That is why the research problem is something which is really fundamental, which is really at the center of the research process, because you must be able to identify a problem that your research will come there and solve. And this is the research cycle. That is the process I was talking about. In the research cycle, you first of all have to identify a problem, always. What is the problem you are trying to solve? Then you should formulate a question from that problem you have identified. Then you should be able to elaborate or to write a research protocol, which actually describes how you are planning to do, how you are planning to work to be able to solve the problem you have identified at the beginning. After research proposal or research protocol, you go down on the field to implement what you have written, what you have planned as your protocol or as your research proposal. After implementing, that will include data collection, data analysis, writing of the final document, and so on. Then you come and present and disseminate to a wider public the result that you have identified, you have obtained, and you should be able to apply those results in order to solve the problem you identify at the beginning. So at the top, at the beginning of any research project, you should have a problem that you have identified. And the proposal usually will aim to explain that problem that you have, explain how you are planning to conduct your research in order to solve the problem you identify by giving all the details of the implementation. And you should also demonstrate in your proposal that what you are doing is something with an ethical value, which are following the different ethical principles that we know. So these are the parts that you usually have: an introduction, objective, literature review, methodology, references, and so on. I just go up there. So the research problem, which is the main object or the first part of our presentation tonight, is usually something that you have observed. That through your observation, you can identify a problem, which will lead you through the other steps of your research process that you will have to conduct, and we will go in more detail of the research problem. So a research problem will have these 3 characteristics. First of all, it must be coming from a fact, a real situation that you have, a concrete situation that you have in your environment. It must not be just from something that you are imagining, that you are thinking that maybe this thing and this thing and this other thing, but it must be from something which is really concrete, which is really practice, that you are able to demonstrate that there is this fact from which I'm coming to have my research problem. Secondly, a research problem must be something that you need to collect and analyze data to be able to solve it. It must not be a problem which can have a solution from something else than data collection and analysis. If you have a problem that you are able to solve it from something else than data collection and analysis, then it is no more a research problem. It is another type of problem. But a research problem needs data collection and analysis to be solved. And thirdly, after the research, the problem must actually be solved. So research must be able to solve that problem you identify as a research problem. So anytime you say, this is my research problem, make sure that you have these three elements which come in the definition of research problem that you have. Let us have some few examples. I took an example on CDTI, community-directed treatment with ivermectin. It is a program or a strategy in which ivermectin is distributed in the communities to the general population in order to treat onchocerciasis in endemic area. An example of problem is that after CDTI was implemented in Cameroon, for example, they realized that there were several adverse events with even deaths which occur after ivermectin treatment. And that makes people being afraid of the treatment, and there were fewer people taking the treatment when the distribution was happening in the different communities. And that is why those at the public health level were just wondering, okay, how can we proceed to reduce those adverse events in the population? And knowing that if we know how to reduce the adverse events, we then reduce those events, and surely people will be more willing to take the drug, and we will have more possibilities to reduce the impact or the burden of onchocerciasis in the community. So that is a real problem that you can be in front at a public health level. And that makes us to have a study on factors associated to adverse events after ivermectin treatment. This is the study we conducted in the research center where I'm working. And we end up with a strategy called the test and treat, because we realized at the end of the study that loiasis infection, which is another filarial disease, was the main cause of adverse events related to ivermectin treatment. So we developed a strategy on testing and treating only those without loiasis, and that's how we were able to come out and to tackle the problem of adverse event after ivermectin. So that is an example of a research problem which leads to a research project with the solution. And other examples which are not actually research problems are, first of all, you will say, for example, doctors are not washing their hands before children examination. We know that in units, normally, medical doctors have to wash their hands in order to prevent neonatal infection. But if you are in an environment where people doesn't wash their hands, the solution is not to do a research project. But you should, for example, take measures like, okay, if a doctor doesn't wash his hand before examination, I will reduce the money I have to pay to the doctor at the end of the month. Let's say 5,000 for each children examined without washing the hands. I'm sure that that kind of measure is able to reduce the problem and to even solve the problem without doing any research there. So there are some problems we just need decision or administration to solve those kind of problems. Those problems are not research problems. So when you are stating your research problem, make sure that you really need data collection and analysis to be able to solve that specific problem. Another example, which is not really a research problem, is when they are saying, for example, that data are not available in our context, or the prevalence is not known in our context, or there are very few data on this topic. That's why I'm doing this topic. That is not enough to do a research, because there are several problems where you don't know, but it doesn't interest anyone. There is no interest about that. So always make sure that you have a problem behind, and the fact of not knowing must just be something complementary and not the main reason why you are trying to do your research. And as I said, there are usually 5 axes that are defined where you can easily find a research problem. You have the axis of the frequency of the problem or the prevalence. Usually will help to solve the problem of decision at the level of a population or at an individual level. So that is the first case. The second axis where you have is the problem of etiology or risk factors of the causes of a problem. Usually it will help in the problems where you are trying to find the best strategy to prevent or to reduce the risk of something. So that is the kind of research problem that you will be solving with study evaluating risk factors for etiologies. You have other problems at the level of diagnosis tools, which also will really help you to choose what is the best diagnosis method in front of a specific situation. And in that case, you will need a study which evaluate different diagnosis tools that you may have in the context. You also have studies evaluating the prognosis, where it will usually help you to have a better decision or to solve a problem on the decision of the management of patients that you have. Management at the level of a unit or at the level of an individual participant. So when you are facing that kind of problem, you usually solve it with study in the axis of evaluating the prognosis or the outcome after a disease. And finally, you have another axis on economic evaluation, which usually will help to solve at the level of decision, public health decision, financial decision at the level of health. So usually those kind of problems will be solved by study evaluating economic aspect or economic impact in a situation. So any disease that you can choose, you are able to have at least 5 topics in those different axes addressing a specific problem that would be interesting. And you have this final framework which helps you to make sure that the problem you have identified is actually something which is feasible, interesting, new or novel, ethical, and relevant in your specific context. And we have an example here where you have a problem, a research problem on scabies, for example. And the research problem usually is something you explain. It is not just a sentence that you give or just a question, but it's an explanation that you give so that the one who is listening to you will be able to understand and say, yes, I think there is really a problem here. We really need to do research here from the explanation that you are giving. So for this example, we can say that scabies is affecting more than 300 million people worldwide, with more than 80% living in poverty or in low resources environment. In such a way that in those kind of environment, you can have more than up to 60% as prevalence of scabies in some of those rural areas. While there is a treatment which is available, which is effective, which is affordable normally. So we are in a situation where you have a disease affecting so many people in an environment where you are able to have the treatment which is also effective. And the challenge is that the diagnosis is not easy for nurses, which are usually those available in that kind of environment. And that is why we are trying to do a study in order to facilitate access to diagnosis in that environment. The study was the development of a diagnosis algorithm for the diagnosis of scabies in this case. Okay, is it feasible or not? We evaluated the sample size that was 240. It should have to cost up to 300,000 francs. We need up to 10 days to do it, and the human resources and all of those things. So we're able to make sure that it's something feasible and interesting for the health personnel, for patients, and for decision makers. Also, it was new because there was no previous diagnosis algorithm for scabies in that case, and we were able to make sure that it is in accordance with the different ethical principles that we have to meet. So we had a research problem that can be used to conduct our research. And what we are supposed to be doing is that you should be able to apply this for your specific topic, to identify what is the problem I have behind, and to make sure that it can fit in the final framework that you have here, and your study is something which is quite interesting. Okay, now to finish about the introduction, it is like the entrance of your work. And I really like this citation which said that you never have a second opportunity to give your first impression. You will never have a second opportunity. Which means that if the first impression you give from your work is something which is bad, which is not interesting, you may not be able, whatever you can write later on, to change the mind of the person who is reading your work, because the first impression will have been already something bad. And the introduction is most of the time what they will first read when they take your work. So you should make sure that the introduction is very well written and can make the person who is reading to be willing to continue reading to the next part, to have a good impression of your work just from the introduction. And the aim of the introduction is to give to those who are reading the motivation to continue reading your work. They should be willing to continue to see the next part just from your introduction. And to achieve that aim, you must be able in the introduction to explain why you are doing this study you are trying to do. And that will refer back to the research problem. You should be able to explain what you are planning to do. What is the interest of the topic you are doing? And finally, you should be able to put everything in the environment, in the context where you are trying to do your research, in such a way that you clearly understand what you are trying to do, what is the environment where that is happening. And you will usually have 4 sections in your introduction. The first one is the definition of keywords. The second one is that you should present the context or the importance. How relevant is the topic you are trying to work on? Thirdly, you must state what is the research problem, as I said before, and finally, the interest of your topic. You can have these different parts in one block, in one paragraph, or you can have it in different sections. Most of the time, maybe just say context and justification. Maybe something like definition of keywords and so on. But at the end of the day, you should make sure that you have all these elements in your introduction that they should be able to be found there. And to write an introduction, always start by doing a plan. You should have the plan of what do I want to put my introduction. The first step of writing an introduction is not to open a blank page or to try to find articles. No. First, have your plan. Identify what are the informations that you need. And then you can try to find article and information to fit in and to draft what you have as information. So those are the different steps. As I said, you have the definition of your keywords, those who are more important. And it is not the case here to bring back the history of the topic, no, or to bring back so much details on the mechanism and pathophysiology. No, it is not the place here. Just give key definition here, and then you move to things which can make people afraid when they are trying to read your work, that they can realize that this is something which is really, really important because of the figures and the indicators that you are giving. And you can either use the prevalence, the mortality, the incidence, the complications, and so on, just to make sure that you are presenting something which lets people understand and know that what you are working on is something quite important and interesting. And you will do it from the general view to a particular or a specific view, the context where you are working. This is an example that you can maybe read later on, presenting what I'm trying to set as the context. The research problem, as I said before, you should be able to explain it here, the second part, the third part. And finally, you should give the interest of your topic. The so what? You have said this and this, then how will your result be useful to solve this problem you have just identified? And that is usually the last part which close or which end your introduction and making something which is really interesting.